So I'm Bruce Compton. I'm the Senior Director of International Outreach for the Catholic Health Association of the United States. I'm pleased to be here to facilitate this panel about lessons learned in partnerships. And this morning we heard words like equity, efficiency, effectiveness, and responsiveness. We heard about incentives and innovation. We've heard about needing to be stronger in our partnerships. And this session is really to talk about partnerships and lessons learned. And I think we also heard this morning that we have we've been through a lot of partnerships. There are a lot of lessons. I think the second part of that, learning from those lessons and changing our direction and where we go based on those lessons learned is really what's going to be helpful. And we've asked the people that are here with us, who are joining me on the stage today, and via technology, which we've also heard a lot about, to take a hard step of not only telling us about the successes that they've had in their partnerships, but also to talk to us about the challenges and the barriers in partnership across all of the different stakeholder groups. So let me introduce the panel. You all can see him. We can't from here with the technology, but we have Christophe Longuet from the Mérieux Fondation in France, Andrew Jones from Tropical Health Education Trust, THET, from the United Kingdom, and Clarion Johnson, the co-chair of this forum, as well as former Chief Medical Officer of ExxonMobil. And they will be talking to us about these lessons learned. Christophe, welcome virtually to the meeting, and hello from all of us in the United States.
Thank you.
So,
should I start?
I will just, Christophe is going, I wanted to make sure we could hear you. I think we're going to need just a little bit more volume. Can you all hear Christophe?
Yes, I hear you. Hello, good afternoon, everyone.
Yeah, okay, Christophe. So Christophe is going to talk to us about partnerships for building clinical lab capacity. Christophe will specifically focus on the Foundation's partnerships in West Africa and how Ebola has shifted their priorities and strategies, their expectations, and their collaborations with local partners in that region. Christophe has just returned from 2 months split between Sierra Leone and Guinea, and he will start us with a few slides about their partnerships and lessons learned. Christophe, it's to you.
Thank you, Bruce. So I'm very happy to join you for this session, although I would have been, of course, happier being with you in New York City. And I'm happy to share the experience of Fondation Mérieux on lab capacity in West Africa in a public-private partnership where we are the private sector partner. Next slide. So I think that Louis Gresham, the CEO of Fondation Mérieux in the US, has already shared with you about our foundation, so I will go quickly. So we are a private family foundation of almost 50 years old with public objectives and the status of public interest. Next slide. So the mission of Fondation Mérieux is defined as to strengthen local capacities in developing countries to reduce the impact of infectious diseases on vulnerable population. And also we have the same president. We are, together with Fondation Mérieux USA, we are separate from Institut Mérieux, which is the holding company of our president, Mr. Alain Mérieux and Alexandre Mérieux. So I will not go in more details here, but maybe in the discussion we can discuss the challenges that we can have being close to Institut Mérieux. Next slide. So our main focus currently is to build diagnostic capacity for the identification of infectious diseases in developing countries. really, the diagnostic and the laboratory capacities is one of the most neglected components of the health system of most of the countries with limited resources. So building this component of the health system is providing the capacity to provide better care. And as Mr. Mérieux said, without diagnostic, medicine is blind. So we try to make the medicine in developing countries less and less blind. So we have three focus. One of them is applied research capacities. Second is health system strengthening, and that's where we will talk about our example tonight in West Africa. And the third one is knowledge sharing, and we develop courses and conferences mainly for health professionals of resource-limited countries. Next slide. So we have many funding partners. I will not detail them, just to show you that we are partners from the health industry, from private foundations, from governmental organizations, and also we are happy to have WHO as a funding partner. So it's not usually a funding partner, but it supports some activity with financial, WHO support us with financial resources. Next slide. So for operational partners, we have as well many partners from many countries, including academic institutions, ministries of health on different continents. Next slide. So we have a global presence in Asia, Africa, Latin America, and the Caribbean. And you see on these slides the research and reference laboratories that we build in developing countries in area where there are infectious diseases affecting the population. And we give we hand out these laboratories to either the Ministry of Health of the country or health universities, or sometimes like in Haiti to NGO, like the GESCO. Many of you may know the GESCO in Haiti. So we really give them the center, and we help them, of course, run it, and we share the operational cost with them. Next slide. So now we focus on West Africa, and with a particular example of a project which is called Réseau Lab. It's French acronym for Réseau d'Afrique de l'Ouest des Laboratoires, the West African Network of Laboratories. So this project has started in 2009, and with the objective to improve the quality of laboratory services for patient care and disease surveillance. So one of the focus for the training is the training and the continuous training of the health professional and the lab professionals throughout the countries. Another component is the quality assurance system, and with the supervision of the peripheral lab, which usually doesn't occur. And we also build a component of surveillance of the infectious disease from the laboratories. So the first phase was started 6 years ago in Burkina Faso, Mali, and Senegal, and now we have entered since 2013 in the second phase in Benin, Burkina Faso, Guinea, Mali, Niger, Senegal, and Togo. Of course, our objective would be to include all the West African countries, and this is one of the objectives that can also be achieved through another project which is called WORLDS, West African Regional Disease Surveillance Project, which is funded by the World Bank, which is operated by the West African Health Organizations, and where Fondation Mérieux is one of the partner for the laboratory capacity building. So for Réseau Lab, we have different funding partners. The main funding partners is a French development agency, AFD. So it's governmental agency for France. We also have happy to have a support from the International Cooperation of Monaco, another support from Islamic Development Bank, from a Greek foundation. So that these are the main funding partners. But for operational partners, of course, we work with the ministries of health of the different countries, and we have the umbrella support of the West African Health Organization and WHO in Africa. So, as you can see here, the challenge that we can face with different partners is that they have funding partners and they have different objectives. And for instance, with the Monaco cooperation, they want only to support projects in Niger. For Islamic Development Bank, they only want to support training, but not building infrastructures, because we build training centers, we equip training centers in this project. So they want to focus on the training of the people. The AFD, for instance, doesn't want to look at some custom taxes that we occurred, because AFD usually worked directly with the Ministries of Health and the Ministry of Foreign Affairs and finance of the countries, and in their agreements they usually have a waiver of the taxes. But for this project, it's one of the very few projects where they accepted to work with a private partner, Fondation Mérieux, because of the transnational aspect of this project. But we face issues with the process of the AFD. One of the main challenges as well with the AFD when we started the project was to build trust with AFD. Of course, Fondation Mérieux has a very good reputation, but they were suspicious that we would do marketing for the Institut Mérieux and the BioMérieux company. So really, we have to reassure them, and we have to, of course, to comply with the international way to do the bid, international bids. And of course, we give ownership to the Ministry of Health and Directorate of Laboratories of the Ministry of Health of the result country to make the choice for their projects, for this project. So I will not go through all the achievements so far. I mean, it's an ongoing project, but just for the partnership aspect, I mean, really for us, the most important was to give ownership to the Ministries of Health and the Directorate of Laboratories they have. So one of the challenges is that many countries do not have, and it was the case, do not have a Directorate of Laboratories. So they have usually Directorates for drugs, and it includes a small section on laboratories, but the drugs is the main section. So one of the, let's say, externalities of this project was to highlight the need for more resources, human resources from the MOH on the laboratory directorate within the Ministry of Health. So the way the project, the governance of the project is that we have an international steering committee which meets every year. But we also have national steering committees, and they are organized within the Ministry of Health, and they include several vertical programs like HIV programs, TB programs, malaria programs, and other like meningitis. So really, it's the local people who decide what they need within the project. And of course, one of the challenges is to have the limit of what we can offer within the project. They have a lot of needs. We provide the framework, and within the framework, they really build their own projects for their own national laboratory system. So they've all worked on their national plan. They have all worked, developed training modules. And at the beginning, we wanted to build the training modules for lab professionals in mixed team with French experts and African experts. And they say, no, we don't need French experts. We have the expertise locally, so we will develop the training module ourselves. So we organize train the trainers sessions for them, and they roll out the training to their lab professional. They know the best what this professional needs and how to train them. So one of the achievement which was not planned at the beginning As I said, it's the creation of the Directorate of Laboratories in several Result Lab countries, like in Senegal, like in Niger, and it has been strengthened in Burkina Faso. So it's on the process of being strengthened in all the countries. So also the recognition by the World Bank that Fondation Mérieux is a key partner, and so we are involved in a bigger project with the World Bank. And the next slide we'll show you how we have been embarked on against Ebola, mainly in Guinea. So as you've seen, Guinea was one of the countries of the Result Lab project, and because of the flexibility of our funders, mainly AFD, the French Development Agency, we have been able to reallocate budget against the Ebola epidemics, so mid-2014. Where are most of the help was to create Ebola treatment centers and laboratories at the central level. So we focused, which is the expertise we have with Result Lab, we focused on the lab professional throughout the countries. And so we trained more than 100 lab professionals in Guinea, and really the capacity of this lab professional was very low, and the biosafety practices they had were very low, and some of them were using the mouse to collect the samples of blood and analyze these samples. So we train the professional in Guinea, but also in the other West African countries, more than 500, on Ebola and hemorrhagic fevers. And we also provided them safety equipment, again, on a decentralized way. And we have secured, because it was an issue for many countries when they have a suspicion of Ebola and they were not in Guinea, Liberia, or Sierra Leone. It was difficult for them to have a sample analyzed. We organized a safe system for transporting specimens to the BSL-4 lab, Jean Mérieux in Lyon, at the beginning, and then to West African laboratories. So we provided a lot of equipment. We trained a lot of professionals because, as you know, they were at the forefront of the epidemic, and they paid a huge price to the epidemic. So now it's with that experience, we've been asked by different partners and the French Ministry of Foreign Affairs to participate in the post-Ebola period, which is hopefully coming soon, and to help rebuild or simply build the laboratory system, the full lab system in Guinea, not only for disease surveillance, but also for the care of the patients, which is important. For me, it's a key message here. We all want to focus on surveillance of epidemics and diseases in these countries, but they also need a laboratory system for the care of their population. And we have also been identified by the WAO and the ECOWAS country to participate in the creation of the Africa CDC and the West African CDC, where the laboratory component will be important. So my last slide. So really, I don't know how many times I have, maybe not much more. So really, the lessons learned for us is that with Result Lab, we've seen that we need to build the project with our partners, not for them. It's not to come with a ready-to-implement project. We have to develop the project with them. Second, next slide. We need to understand each other's perspective. And for instance, we usually focus on medium or long-term objectives, where the issue they face in Africa is short-term issues. How to have enough reagent, diagnostic test, or can we have the fuel for the supervision missions? So that's an example, and of course there are many cultural aspects. So we are very focused. I mean, for us, the time is an emergency. They have more time than us, so we need to learn from each other. Next slide. So the countries implement the training modules themselves, so we just help them start the actions. We provide, let's say, the fuel, the funding for the actions, but they have the ownership. They know what they want to do, and they know how to do it, so we let them do that. Next slide. So we need to develop clear agreement, of course, at the beginning of the project, but we also need to be flexible. And for instance, Ebola epidemics in West Africa asked us to be flexible and to reallocate our objectives, and maybe some of the objectives were on standby, and we have to focus for 1 year on Ebola and laboratory strengthening against hemorrhagic fevers. So next slide. So partnership is a learning process, so we have to be open to learn from our partners in Africa. They have a lot to teach us on their countries and how things will have to be implemented in their country if we want to aim at the sustainability of the project. So next slide. Thank you very much.
Thank you, Christophe. We're now going to turn to Andrew Jones from THET. Andrew's going to talk to us about partnerships and a twinning model for hospital partnerships that are for workforce capacity building through volunteer mechanisms.
Thank you, Bruce. The first thing to say is, you know, I'm the guy from the UK NGO, no tie. I'm going to be focusing a little bit more on partnerships from an operational perspective and how we operationalize the ideas around what partnership means. And when I talk about, for instance, engagement with the corporate sector, what I'm talking about is coming from it from the point of view of an NGO working with corporate entities around their CSR activities rather than commercial activities. Won't be the same for all NGOs, but that's where we are. Third thing to say is, because I'm on a short trip here, I've decided to try and not get too much into the time zone. So just want you to know, as far as I'm concerned, I've left work now, and I'm heading down towards bedtime. So I'll see if I can stay awake for my presentation. I will. And then finally, my colleagues have told me, through bitter experience, never to extemporize, because they say, Jones, you just suck up all the time. So I'm relying on a bit of technology. I have to unlock this tablet, and you've got to love targeted advertising, haven't you? Do I want to subscribe to a prepaid funeral scheme? Not today, thank you. So I know that when making a presentation, yeah, I know I'm in full screen mode. Yes, thank you. Many people suggest that the most important message in the presentation, the punchline, if you like, you should be leaving till the end. Well, I'm going to face down convention and, after a bit of context setting, deliver my punchline early. I was in Geneva a month or so ago at the World Health Assembly and attended a side event there around public-private partnerships. And much of what was being said was really interesting to me, but I had a nagging feeling that something important was being missed. And then it occurred to me what was nagging at me. And people were talking about partnership as though it was some simple formulaic response to complex issues. So when the time came for debate, I couldn't resist the opportunity to contribute my overrated wisdom to the debate, and after a few preliminaries explaining my experience and field of work, very pompously announced that partnership is a mindset, not a formula. Imagine my surprise then when I found this pearl of wisdom being tweeted as though this was some kind of new magical learning. So there you have it. Partnership is a mindset, not a formula. And furthermore, in my world, it's about relationship and not systems. So let me give you a little bit further context and explain what it is that the organisation I work for does. THET, the Tropical Health and Education Trust, has a 25-year history working to develop a credible model of partnership to help train, educate, and upskill the health workforce in developing countries. Over the years, over 200 health partnerships have emerged, and what we mean by a health partnership is a partnership between a UK health institution, quite widely defined, including royal colleges, universities, hospitals, obviously, and their developing country counterparts, using professionals from within the UK health sector to deliver capacity development initiatives to their counterparts in developing countries. About 4 years ago, the UK government, through DFID, funded a $55 million programme called the Health Partnership Scheme. I know scheme means something different in the US. This is perfectly legitimate. It's all right. It was the UK government. So the Health Partnership Scheme was formed, and we managed that on their behalf. So what was the motivation for this unprecedented level of investment in an unproven methodology? Well, essentially, they wanted to see whether this kind of institutional partnership model could maybe deliver results in capacity development of the health workforce, which more traditional methodologies found difficult, particularly around sustainable behaviour change. So far, and we're in year 4 now of 6, we've just reported, had our annual review report through to DFID. Over 35,000 health workers have been trained, supported by 1,500 unpaid volunteers from the UK health sector, with the ultimate measurable outcome of improving health services in the target areas. Now, traditionally, if a training need was identified, maybe consultants would be sent in and being commissioned to deliver the training. That was their job. They got paid and went on to the next job. There was little, if any, follow-up. Now, because partnerships, the type of partnerships that we're talking about, are based on relationship, however, what we find is that even when the funded activities come to an end, the relationship continues. And there is an opportunity for ongoing and sustainable support to the overseas institution. Now, in my organisation, we have to constantly remind ourselves that there is a difference between the project, the time-bound thing which we're putting money into, and the partnership, which provides the basic infrastructure and the relationship to deliver the project. Some of the partnerships we work with have been going for 20 or more years. They raised funds themselves to do the things that they did. And it was only when we came along with funding 4 years ago that they were able to scale up their activities. In international development and global health circles, much of what we do and how we do it in a contemporary setting comes from the principles set out in the Paris Declaration on Aid Effectiveness in 2005. The Paris Declaration placed an emphasis on development interventions being led by the South in an attempt to stop developed countries doing development to developing countries. There was a new emphasis on partnership, in quotes, a step further on from the ideas around participatory development which emerged in the late 70s and 80s. Partnership became the thing to be doing. And Cathy Impney and John Overton made this interesting comment in Community Development in April 2014. Such has been the popularity of this approach to partnerships in development that donors began to use the term widely in their mission statements and project proposals, often as a surrogate for participation. And they even adopted the term for themselves, donors becoming development partners, in a semantic sidestep that obscured the underlying and continuing imbalance of power. So what have we learned? Firstly, partnerships are a powerful and formidable force for bringing about change, but not just the immediate change, sustainable change. A great partnership never gives up or throws in the towel. Secondly, there are certain hallmarks of an effective partnership which, if missing, are likely to render it ineffective. And we're talking about some work we've been doing over the past year to draw some of our learning about partnerships together in what we're calling our Principles of Partnership workstream. And you can see there, I won't go into them in detail, but 8 domains primarily, about being strategic, harmonized and aligned, effective and sustainable, etc., etc. And underneath each of those domains will be anything from 4 maybe to 7 hallmarks of what partnerships need to be doing, or what they can do in order to meet the quality standard, if you like, for partnership working. We're still working on this. We hope to have it all published by September at our annual conference. Thirdly, it's vital that expectations are managed appropriately. Either side is capable of letting the other side down, but well-managed expectations and clear agreement at the outset will mitigate against this happening. For me, or for us, it all comes down to trust. We've heard that 2 or 3 times already this morning. Let's think about that for a moment. If I'm going to enter into a meaningful partnership with you, or with a corporate or another NGO or a government agency, I have to get to a position where at the very least I believe and know that you're not going to stitch me up. But more than that, I need to know and believe that not only do you want good things to flow from this relationship, you actually want the best. And of course, for this to work, you need to know and believe the same of me too. So now we begin to see why we can't approach partnership in a formulaic way. What can I say about success and failures? Well, interestingly, one of the highlights of my year last year was talking about failure with some colleagues from St. Louis University. After a conversation I had over dinner with a couple of folk from there, we decided we would set up what we called grandly our Transatlantic Failure Conference, where 2 teams, one from St. Louis and one from Thet in London, met on a Skype conference for about an hour talking about what happens when partnership fails. Why do they fail? And it was a really interesting and stimulating conversation, because we just agreed that the thing is, you don't bury your head in the sand when partnership fails. You say, well, why did it fail? And begin to learn the lessons. And those lessons are reiterated then in your next expression of what partnership can do. In the end, success is in understanding and applying the principles of partnership. Failure lies in ignoring them. I'm sorry to be so simplistic. I almost feel embarrassed that you've flown me here and put me up in this wonderful city for me to come with such a simple message. I could have actually done it by email. But I do have a couple of closing comments about partnerships with corporates and government. My experience with corporates, and those of you from the sector will hopefully bear me out, is that we need to listen very carefully to what it is that is driving the organisation in the particular direction of partnering with my organisation or your organisation. I can only speak from experience of working in an NGO corporate partnership setting, but a company's CSR policy will most times have had as much time spent on it within the organisation as any other major decision. Get to know the motivation, talk to the people, understand how you can work jointly for mutual benefit. Partnership with government agencies is different, or is it? Government, after all, doesn't really have a heart. That may be true in a very generalised sense, but here's the surprise: even the most cynical civil servant has a heart. I wasn't looking at you, Simon. When we started the Health Partnership Scheme 4 years ago, I knew that there was open hostility towards the funding of this approach at this scale of funding. It was almost like being funded by government for some wacky alternative medicine therapy which had no basis in science. 4 years later, I'm invited to meet 60 DFID health advisors at their annual conference in Scotland. One by one, those who had been most outspoken in their opposition came to me and talked. They didn't exactly apologise, but they did acknowledge that they had been wrong to judge so quickly. How did that happen? We built relationships with individuals, we talked to them. Most importantly, we began to provide evidence of the effectiveness of our approach. So I think that's enough from me for the moment. There are others who've got plenty to say, and I'll be pleased to answer questions later. Thank you very much.
Thank you, Andrew. And now we'll hear from Clarion Johnson about a corporate perspective. Clarion. He also told me he's one of the most serious people in the room.
Good afternoon, everyone. This is amazing. I get to follow behind a guy who speaks so well and describes in ceremonial terms failure. I can't wait. Oh, unfortunately, after hearing him, these were my notes that I wrote at 2 o'clock in the morning for this talk. In retrospect, they're more like Charles Manson on Ritalin. God. Okay, well, first of all, I want to thank you all for allowing me to come, and all the preceding panelists this morning and speakers, as well as the speakers. And particularly, I'd like to highlight the posture that Dr. Vega allows me to come in with, and that is to really talk about what did not work and how to learn from it. Again, the preceding speaker was able to do that, and I think that's where you really get a lot of gusto as far as energy, or in my former career, octane for going forward, and what works for you. And say my goal really is, as a former speaker, is to get you to think about the corporate partner in a reflex manner. To ask yourselves, whenever you're undertaking a task, who is missing from the table? It may be an agricultural minister, it may be a finance minister, but in a reflex manner to say somebody else should be here. And I'm going to try to give you some examples of where I think the corporate partner can play a role. And particularly, I'd like to describe it as a win-win phenomena for everyone. And what is winning? Winning is a lot of things, but I think in the business parlance and business speak, it is capturing efficiencies. What is there, what hasn't been used appropriately, and what can be used as you go forward. And again, you want to talk about mistakes? I got mistakes. Okay, I've got tremendous mistakes. I won't mention the countries, but I will say that one of the first things I came across was I was in a country, and the political leader would not allow street signs up in one of the cities. The leader was afraid of being invaded, and if there were street signs up, troops and others could follow to his headquarters or wherever he was. That posed a problem for me in the medical arena, because how were ambulances going to get to hospitals? So in that case, I was able to put in GPS systems in the ambulances so that they could find the hospitals and clinics. Sounds like a minor problem, but if you want to get people to someplace because you have issues, that's what you have to do. You have to sort of think on your feet. So that was one small issue that I thought about and learned from. Another an avenue for a medical director in a corporate arena to have to respond was helicopters and evacuations. Evacuating in bad weather, what do you do? What if it's, how do you determine what the necessity of the evacuation is? Do you want to send a helicopter out? And in this case, we were able to bring into a particular country telemedicine. Telemedicine helped us immensely in making a diagnosis, deciding when the helicopter should go out, and timing. Again, this was an introduction into a particular country of telemedicine that had not been used before. Again, on the ground, corporate medical director trying to find some avenue to work with the local indigenous population, and of course, whatever we do stays there. It becomes part of their infrastructure. And then a third example that I'd like to share with you, and that was inadequately assessing the infrastructure in a country. There are lots of things in life you really don't want. And in this particular case, someone came from a country, West African country, via plane, fully packed plane, then went to a oil rig platform and got very ill. All of his examination profiles were within normal limits, and then he was evacuated to a hospital and died. It turns out he had disseminated TB. The local in-country skin testing was misread. The local x-rays were misread. And I got a call from the state health department. It's kind of, sort of, for the civilian, it's like having 60 Minutes knock on your door and say, we want to talk to you. Was not a highlight of my life. Good news is that we were able to bring our public health people in, working with the state, and screen people with a level of efficiency and effectiveness that they were pleased. We also were able to bring teleradiology into the country so that x-rays would be read by a second person. We were also able to bring in a blood test called quantiferon to highlight and further investigate the status of the person's TB or future people with TB. So those were real learnings for us. That particular state was so impressed with how well and efficient we were that when we had the anthrax scare and had a couple of sites that were involved, they wanted to know how we managed it when they had a particular incident in their vicinity. And we showed them our procedures, our manuals, how it worked, and they were quite pleased. So again, we learned, we shared. They also came back to us for the H1N1. How were we going to do it? And asked, would we be a local repository for medicines? Because we knew how to store, we knew how to disseminate it to the community. So again, we learned. Now, if you ask, it's always a great fear of failure. This is a business failure. I've described what might have been catastrophic medical failures for me had they been allowed to progress. I mean, not being able to find a hospital in an ambulance, not being comfortable with my x-ray capacity. These are things, so a business failure, but on the other end of a corporation, there are the medical failures that you have to be concerned about. Now, how do we, in our interactions, discuss what we need to know about each other? With regard to historic mistakes. What is a historic mistake? I asked the first speaker today, well, what do you learn? What do you see? How do you go back into a community? I remember flying over Papua New Guinea via helicopter, and I saw tons, it appears, of burnt-out clinics, burnt-out hospitals. But there was only one consistent hospital type that was still standing 100 years later. It was the faith-based. I now make sure I always have, where relevant, where possible, faith-based entities at the table. It was amazing. Everything is burnt out. And I said, well, why is this? Oh, they've been here 100 years. They accept all people. Again, for me, a big learning. But we are going to ask of you, our partners, how you do what you do, how you are credentialed, who shows you, who allows you to work in what country, how you work in that country, and above all, are you willing to share your procedures with our auditors? We need, we're talking about corporate branding, we're talking about corporate reputation when we work with you, so that it is incredibly important for us that you allow us to look at your internal procedures so that we can audit them with the same fervor. It's sort of like a hydrochloric acid enema in some respect. It doesn't really stop for anything when we have an audit. It just goes to the heart of the matter, and that's what we really want to glean, how you work. Because it's about corporate citizenship, and allow some of our language to be shared. If you can't measure it, you really don't know what you have. So for us, it's incredibly important that things like metrics are involved in any interaction we have. So a picture should be emerging for you about what it is essential to us. Every corporation, though, remember, has a specific flavor, a specific identity, has a specific culture. The oil industry, the extraction industry, it's often about safety. When you go in, please remember that. It's about safety. The IT industry, it may be bandwidth, what's shared, what can be stolen, et cetera, et cetera. And remember, we have a common enemy, the greatest terrorist of all, nature. And that has to be kept and held in account as we go forward. And whether it's MSF working, whether it's the Army working, we may find ourselves, as we most recently have, all in need of working together. So again, from the corporate perspective, it's tough. But again, not something that can be done because we are thinking about three things initially: our worker, his family, and his environment. And when you take into that several other issues, the fact that we need a transparent environment, we need sanctity of contracts, and where possible, that we all speak the same language. It's the art of the deal. Some deals seem important to some and less important to others. I've often thought that this is Manhattan Island, and it's the Indians selling it to the settlers. Interesting deal. For me, it was important because the Indians sold something that could not be farmed, so it meant nothing to them. They might now, but again, they learned. What am I avoiding? What is my greatest fear? Alfred Newman. If you're young, you don't know who he is, but he is stupidity at its best. And not being seen by management because of a lack of preparation, a lack of knowledge of what you're doing in your respective portfolios, how that blends with what I need to know about you, and making sure you know what I have to know to go forward to support and promote you. If I'm going to promote a partnership, I need to know what makes you tick, how flexible you are, how you're going to work in terms of your corporate strategic plan. Do you have a strategic plan? Do you live up to it? These are all the ingredients, I believe, in a successful partnership that I, as a corporate physician, needed to bring to my management so that I had what I felt to be was an appropriate deal where everyone was comfortable, where failure was avoided, and the pain of it, different between financial failure and health failure. And lastly, to make my co-chair comfortable with what I know and what I'm supposed to be doing from a corporate perspective. And that's Joe Ivy. So thank you all very much. I deeply appreciate the opportunity to share some of the on-the-ground perspectives that a corporate medical director faces, his or her needs to interact with the local community, and above all, to where possible, avoid as many of the mistakes that have been made in the past and not duplicate them. Thank you very much.
Thank you, Clarion. We have time for a few questions to the panel, Christoph, Andrew, or Clarion. There were some themes that came through pretty strongly, though, from all three, and I think it's something we talked about yesterday among the forum members, and we hear in nearly every talk that we've heard today, and that's trust among the partners. So I'd like to start by asking a question. Clarion, you gave one example of how you build trust, but by example, how else do we build that trust amongst these various partners? And do you have specific examples, any of you, Christoph, Andrew, or Clarion, about how we come to that real understanding so that trust is there between the partners.
For me, it's always assuming that whoever I'm dealing with is a we be. A we be means we be here before you, we be here after you. Translation, they've seen lots of people come and go making great promises to them, great plans. I want to know where it hasn't gone right in the past and what I can bring that is novel and where I will not be seen as someone who will be short of breath when it comes to fulfilling the obligation, and tell them that in one of the industries I worked in, we think in terms of 25 years. So I am there for the long term, and I very much wish to leave, when I decommission my activities, some infrastructure, possibly not bricks and mortar, but from an academic and or learning perspective, something that lasts.
Yeah, I think from my perspective, this is about action speaking louder than words. One of the fundamental principles that we operate by is that in developing projects which work through the partnership model, that needs should be identified and agreed locally and with local solutions for implementation. And I'll acknowledge a failure here because I had a conversation in Malawi with a Malawian partner who'd been involved in the development of some curriculum materials around mental health. And I said, so, how did the partnership work out? And he said, well, it's okay. I said, well, you don't seem very happy. He said, well, they came and they asked us what we wanted and we talked a lot, and then they went back to the UK and completely ignored what we talked about and just did their own thing. And so that doesn't engender trust. And trust is about a number of different components. It's about mutual accountability. It's also about respect for each other, mutual respect, and being able to acknowledge that there are mutual benefits at play here. It's not the one-way street. So I think there are a number of different components that go to this complex thing called trust. But in the end, I think it's about how you act it out rather than what you say.
And Christoph, do you have anything to add?
Actually, what I wanted to say has been said. I mean, really, it takes time, and it's really a proof of in the action. I mean, you really have to demonstrate that you are the trust can be given to you. So really, it's a relationship in action, the trust, and it's not given at the beginning. It really depends on what you do, individually in terms of behavior and as an organization in a collaboration. Thank you.
Thank you. I came here directly from Haiti, where I'm working with the Archdiocese of Port-au-Prince in a hospital. And this very week, we had a consultant there, and the doctor who the consultant is working with on management capacity building said most people come here telling us they want to do what we want. And as soon as we tell them what they want, they tell us what we need. And that doesn't build trust. So I think we have to really, I think what we've heard is trust is relationships and listening. And we heard this morning finding people with the right motivation. And the motivation has to be to help them oftentimes if we're in doing this, and not so much about us. And Patrick, you have a question.
I guess over the last few minutes, the conversation seems to have been how to persuade people that you're trustworthy. I'm wondering when a corporate medical officer goes in, or someone like you, Bruce, or Andrew, and you are looking for a partner, how do you determine that they are trustworthy, that they will ensure that you are not wasting your own capital?
Often we have been in a place for a while and have an idea of the lay of the land. We do an incredible due diligence with all of our partners, looking at where they've worked before, how long they've been around, have we shared the same space? We may have been in the same space for a long time and not interacted. It is not as difficult as you would think. And we also look at credentialing bodies, whether it is the Joint Commission, local bodies, local universities. But again, if you've been around over 100 years, and in some countries over 100 years, you have a fairly sophisticated network of insights that you can pull from.
Yeah, and I think it works the other way around as well. I mean, we do the due diligence on the partners that we engage with as well, and just it's a very hot topic for me. We've just been working with a large corporate and coming to a point where we will probably work with them much more closely. And then one of my board members said, "Oh, but they're involved in arms," and so we had a good look. And less than 3% of their profit actually comes from not from arms but from military avionics, if you like. And these are the systems which help countries to defend themselves. And I'm quite pleased there are people out there doing that sort of thing. But we get caught up sometimes in this rhetoric around military spending, arms, and all the rest of it. Yes, if someone was producing AK-47s and giving them to militants somewhere, that would be a different matter. But so we need to do the due diligence as well. Our constituency obviously has a particular view about what we should and shouldn't do in terms of engagement with the corporate sector. But at the same time, we have to be sensible about it. In terms of trust, again, I come back to, I think Christoph effectively said, you don't just get trust, you have to earn it. And it takes time, and it takes the building of relationship.
So I'm not here to share my lessons learned, but boy, could I tell you some stories about what not to do, and that we, in some cases, we haven't established that relationship well enough to know the capacity of our local partners, and I think, that relationship and before you make big commitments and understanding them is just so important. So that would be my answer. Joe, do you have a?
Yeah, thanks. I wanted to ask if there's a tension, and from each of the points of view, I think we've heard over themes, sort of a tension between trust and the need to take credit for what you're doing in the partnership. I mean, our corporate colleagues have described you have to make the case to your CFO or your president, or we've talked in another context. I've got to brand my initiative, so that I can, and CBOs have the same issue, so I'll get money again from a donor. I've got to show that I deliver it, et cetera. So I'd like to just hear you explore that a little bit about, is there a tension there? How do you manage it? Sort of just talk about that bit.
I'd say it would be company specific. There are certain companies that really don't need the press and are much more comfortable working behind the scenes to get things done. I mean, they're very comfortable in their own skin with this, which is maybe not healthcare, but see healthcare as a asset, and that if you are working well inside the fence, the ideal situation is for people to ask you to be a enzyme in getting things done outside the fence because you do it so well inside. But I never, ever felt pressure to publicize what I did, but I did have to explain what I did in a very rigorous fashion so that I was using the same standards in applying it to the outside that were used inside, and that I had a global approach so that it did not vary from one region to another.
Yeah, I'd agree with that, and I think one of the things, one of the principles that you will have seen up on the screen is that of mutual benefit. And I think if you can ideally come to a situation where both sides are winning, then that's the golden moment, if you like. And within this model of health partnerships, which I was talking about earlier, the mutual benefit comes from what those folk from the UK health sector bring back to the UK NHS after their period of volunteering. And we're beginning to show some extraordinary evidence about the increased quality of input from those people when they go back into the UK health sector, to the extent that there are now NHS trusts in the UK where the chief executive, one of them in particular, said to me, the reason I get involved in this is not because it's a philanthropic activity, it's because I know that I'm going to get the best staff, and it gives me a competitive edge over the trust next door. So there is a business case there for that enterprise, if you like. It's almost like a private sector enterprise because they are a cost centre on their own. There's a business case for them to get involved in this because they know it's good for their business, not just because it's good in a philanthropic sense.
Christoph, do you have a response to that question?
No, not much to say. But for the previous question, I would like to say that the challenge is not to choose partners. Sometimes the problem is that you have no choice. Your partner is given to you, and then sometimes you have to decide how far you accept to negotiate in the relationship and what you will not accept. So the difficulty is to stop a project and to stop a relationship when the trust has not been built.
Excuse me, I definitely agree with that. For instance, for me, safety was always non-negotiable. If there were any aspect of safety, patient safety, employee safety, if that came into question, it was non-negotiable, the deal's over.
We have time for 2 more questions. 3 more questions. Patricia?
Just to add, I mean, the issue of trust, I think it's great we're talking about it because it is so important. The area of brand's important for both sides. You know, I think particularly for NGOs, both international and national, we're there for the long term in most cases, and you're really building that trust with the community and with the government. So you have that relationship, and then when you add on another partner, you have to be really careful about doing that and doing the due diligence on both sides because you've got that relationship with that community, and they trust you. Your staff are living there, they're working there, and so that becomes so important because once you lose that, you can't work there anymore. So that's really important. But another point is just speaking the same language. I think I find a lot that we're having to educate each other on the language that we speak, whether it's from an NGO or a corporate partner or a foundation. And you can get over that, but you have to have the right people in the room. And sometimes we start with the wrong people in the room because you want to start crafting a deal and they're not talking the right language. But so it becomes really important to get people in the room that speak the right language and learn and are willing to learn about each other. And I've seen some really effective things that we've done where we have corporate groups that work with us that send, for 6 months or even for a year, staff that the opportunity to work either at headquarters or overseas, and we find that we get to know them. There's a comfort level, and they also understand better the work we do. So there are a lot of ways to start learning more and educating ourselves about our partners.
And when you're talking about language, you're not talking about English versus French. You're talking about NGO versus government versus corporate. And those, I can tell you from my experience, and I'd love to hear from the others, there's big barriers. And then you bring in the cultural differences, and it becomes very difficult to get over some of those language and barriers.
Well,
I'll just make one comment. Sorry, just make one comment on that. I mean, classically, British English and American English can lead to all sorts of problems. But I think the interesting thing about branding that you talked on, just touched on, Patricia, was we find it really interesting when because we have a reputation to protect, as you do as well, as much as the corporate does, and so it's very clear to us that there has to be that understanding of each other, understanding of what motivates each other, and that we are talking the same language. It's a very key issue, and it can so often go wrong just by a fundamental misunderstanding of what's being said. And as you say, sometimes you start off with the wrong person. Fortunately, in the relationships that we have people who are very tuned into what we're about, and our targets, our aspirations are pretty much the same.
Dick?
This very rich conversation has me thinking about the 35-plus year collaboration that I have with colleagues in the northeast of Brazil, and what are the elements there. And I find that that is something that, Andrea, I would like to sort of really drill down a little more on the mutual benefit, the win-win thing that Clarion mentioned. And that is, I think that probably a true partnership that functions in a win-win way may be sort of over and above this trusting friendship, which is critically important. But we sort of touched on it a little bit yesterday under the conflict of interest thing, and getting back to Patrick's question. And that is, start off by sort of defining who we are, sort of what is my agenda, what is your agenda, what's in it for me. I think we classically fail to start out by just fessing up, okay, there's something in it for me to be here with you. And then lastly, I think that to the extent that we can genuinely consider that your success is something that I'm going to count as my success, with or without my name on it, that if you succeed, that's my wildest dream. And then, to the extent that that keeps working, the partnership sustains. To the extent that that stops working in both directions, is, I think, the time that the partnership probably dissolves.
Yeah, just quickly to respond to that. I mean, an example I have from a previous incarnation. I worked as chief executive of a hospice in the UK. Now, hospices in the UK were entirely voluntarily funded at the time. I had to raise something around £5 million a year to keep this place running, and we had a catchment area of 10 miles around the hospice. So it was a very competitive, difficult task. One day, the local rail service provider came knocking on my door and said, we would like to come into partnership with you because, frankly, we have a terrible reputation in this part of the UK, and you have a great reputation, and we'd quite like the idea that some of your fluffiness and niceness and squidginess will rub off on us. And so we thought long and hard about it, but we decided, yeah, okay, we'll go for this. And what they did was they co-branded our carrier bags, which we had from our hospice shops, our charity shops. And for us, it was actually quite a good deal because it said to people out in the community, hey, these guys can negotiate at a level with, it won't mean anything to anybody else than Simon with Network Southeast, to be able to get them into a sponsorship deal. And that was good for us as well. So there is this tension all the time about, they were actually quite a tainted brand. We were the great brand, but it did actually work both ways. And so there was mutual benefit in it. Yeah.
And our last question, Regina.
Thank you. I was going to offer the issue of a shared language. It's not just agreed upon language, but with operational definitions that you've agreed to. Some of my biggest challenges have been where we agreed and meant entirely different things by the word. So metrics on what that actually means is a very useful discussion to have in negotiations. I think the other aspect, and I've been involved in partnerships that are new in kind. There's nothing else like that. These kinds of partners have never been brought together before. And the issue of how decisions will be made can really surprise you, particularly if you're working with big corporations in which your entry is the project team for that thing, whatever it is, but the SOPs for that corporation is that recommendation from the project team gets adult supervision from somewhere in the company. We came to a decision, and then all of a sudden the company said, thank you very much, no, we disagree. And we went, but we had agreed. We were the decision makers. They have their own processes. And we were right, and it got changed, but it was very painful because it questioned the governance of the project. So you have to know where you're agreeing with it. I hope that both of these show up in this concept of principles of partnership somewhere in there, because they weren't in the headings that we saw very, very lightly. But I think I really look forward to looking at those when they're published, because I think the more stabs we take at understanding the principles of partnership that create, have we done this? Is there not quite a checkoff list, but it really forms a very useful guide for the variety of partnerships that we have to engage in. So thank you.
Let me just add one final point, if you don't mind, and that is that for those of us in the medical community, we often need someone in-house to help us with the language of the corporation, because we may not speak it. So the man sitting to your left, for me, has been consistently someone who has kept me abreast of direction, insights, and language that is essential in maintaining a direct avenue of insight about the corporation, its goals, and merging them with the health goals.
Can I just a small commercial? I brought some of these with me if you want to know more about that. But importantly, it gives you the links to sign up to our e-bulletin, which is where the Principles of Partnership will first be published. So you'll get first notification if you sign up to our e-bulletin. It also tells you about the totality of our work, which I haven't been able to talk about, and also has those 8 headline domains for the Principles of Partnership there. So if it's okay, I'll leave them just down on the stage here for people to pick up later. Thank you.
Thank you all. Thank you, Christoph. Thank you to our technology expert in the back of the room that made this all possible. Technology can work to bring us together.